We're diving right in today. We're tackling something, well, it can be a little heavy, but it's so important, especially for folks like you who, love digging into the nitty-gritty, right?
Yeah, absolutely.
It's called acute respiratory distress syndrome, ARDS for short.
Hmm.
And we've got a bunch of research here from the ARDS Alliance.
Hmm.
So we're going to, break it all down. Like, what exactly is going on in ARDS?
Right.
Why is it so crucial to catch it early?
Hmm.
And what does it look like long term, for those who are dealing with it? Ready to jump in?
Let's do it. It's a serious condition, and I think what we'll uncover today will give you a solid grasp of it and hopefully empower you to recognize the signs.
Okay, so before we get ahead of ourselves, let's start with the basics.
Yeah.
What is ARDS? Like, it's not just a bad cough or something wrong.
Oh, no, definitely not. Think of it this way. Your lungs are like sponges, right?
Okay, yeah.
But with ARDS, they get inflamed and fill up with fluid. Basically, those tiny air sacs that are supposed to be getting oxygen into your bloodstream, they kind of spring leaks.
Oh, wow.
So your lungs they can't do their job effectively.
So is it almost like drowning, but from the inside?
Yeah, that's a really good way to put it.
That's kind of scary.
And the scary part is it can hit really fast. Someone could be seemingly fine one day and then bam, struggling to breathe the next.
Oh, wow, that's terrifying.
Uh,
So what actually causes this to happen? I know the ARDS Alliance articles mentioned a bunch of different triggers.
Right. It's not there's not just one single cause. It's more like a chain reaction of inflammation in the lungs. A lot of things can set it off, like severe pneumonia,
Oh, okay.
sepsis, if you have a major trauma from an accident,
Oh, right.
even inhaling something harmful.
Wow. So many different things can lead to the same, critical condition.
Yeah.
That makes recognizing those early symptoms even more important, right?
Absolutely, yeah.
So what should people be on the lookout for?
Well, severe shortness of breath is a big one, the most obvious one. Imagine like trying to breathe through a coffee stirrer,
Okay.
but even that doesn't really capture how intense it is.
Wow.
Your chest feels constricted. Every breath is a struggle.
Okay, so what else? Besides that really intense shortness of breath.
Well, you'll also see rapid, shallow breaths. Think about how a dog pants after a run, but in this case, it's like their body's desperate for oxygen.
Right, it's not getting what it needs.
Exactly, and because of that, you might see dizziness, confusion, even bluish lips or fingertips.
Those are some pretty serious signs.
Yeah.
Knowing this could actually be the difference between, life or death, right?
You got it. Early detection and intervention are absolutely key when it comes to ARDs. I mean, the sooner we can identify it, the sooner we can start treatment and hopefully improve those chances of a positive outcome.
Okay, so speaking of early detection, I know the ARDS Alliance highlighted some risk factors, things that can make someone more susceptible to getting it in the first place.
Right.
Age is a big one, right? The older you are, the higher the risk.
That's true.
And also, pre-existing conditions, things like COPD, asthma, even obesity can increase your chances, huh?
And don't forget about smoking. That weakens the lungs, makes them more vulnerable to damage. And as we mentioned earlier, sepsis, which is a serious infection, that's a major trigger for ARDS. And the same goes for major trauma, like a car accident or even a bad fall.
Gosh, there's so much to consider. I mean, it makes you realize just how important it is to be aware of these risk factors,
Right.
especially if you or someone you know falls into one of those categories.
Exactly. Knowledge is power. Knowing your risks and recognizing those early symptoms, it could really be life-saving for yourself or for someone you care about.
Yeah, that's a really good point.
And if you experience any of those symptoms, especially if you have some of those risk factors, it's crucial to get medical attention immediately. Don't wait. Don't try to see if it gets better on its own.
Okay, that's good advice. So let's say someone does experience those symptoms, they get to the hospital. How do doctors actually diagnose ARDS? Is it a tricky process?
It can be, but doctors have a few tools they use. First, they'll do a clinical evaluation, listening to your lungs, checking your breathing rate, looking for those telltale signs like blue lips or fingertips.
Okay, that makes sense.
Mm.
But I'm guessing they need more than just a physical exam to really
Mm.
confirm it's ARDS, right?
Right. Imaging tests like X-rays and CT scans, those are crucial.
Okay.
They can actually visualize what's happening inside the lungs, show that fluid buildup, and give doctors a better sense of, how severe it is.
Yeah.
And then there's blood gas analysis.
Okay.
They take a blood sample, measure the oxygen and carbon dioxide levels in your blood, helps them determine how well your lungs are functioning and whether you're getting enough oxygen.
It's almost like putting a puzzle together, right?
Right.
Using all these different tests to get a clear picture.
Mm-hmm.
So once ARDS-I is diagnosed, then what? What are the treatment options?
Well, the first priority is supportive care.
Okay.
We need to stabilize the patient, help them breathe, while we're trying to address that underlying cause of the ARDS.
So basically keeping them alive and comfortable while you figure out what's really going on, right?
Right, exactly.
So what does that supportive care actually look like?
One of the most common interventions is mechanical ventilation.
Okay.
It's basically a machine that helps the patient breathe, gives their lungs a much-needed break, delivers oxygen directly to the lungs, and it can be, adjusted to meet the patient's specific needs.
I mean, that sounds a little intimidating,
Yeah.
but I can see how it would be a lifesaver.
Oh, absolutely. In severe cases, it can be the difference between life and death. And while that ventilator is doing the heavy lifting, doctors are working to manage fluid levels in the body.
Okay.
Too much fluid can make the lung congestion worse, but too little can hinder circulation.
It's a balancing act.
Yeah, it's a delicate balance.
What about medications? Are there specific drugs that are used to treat ARDS?
Yeah, corticosteroids are often used.
Okay.
They help reduce inflammation, tamp down the body's immune response.
Okay.
So they can help reduce that swelling in the lungs and improve oxygen levels.
So it's kind of like taking an anti-inflammatory for
Yeah.
like a sprained ankle, but for your lungs.
That's a good analogy.
Okay.
And in addition to those corticosteroids, doctors might use other medications, to support ventilation, manage pain, and prevent complications like blood clots.
So it sounds like it's a very multifaceted approach, right?
Right.
Tackling the problem from different angles.
Yes.
But what about those really severe cases where even ventilation and medication aren't enough? Are there other options?
Yeah. For the most critical situations, we have ECMO, extracorporeal membrane oxygenation.
ECMO, that's the one I was curious about.
Yeah.
So what is that exactly?
Well, it's more complex than just giving someone oxygen. It's a little like a heart-lung bypass machine,
Oh, wow.
but for longer-term use.
Yeah.
So essentially, ECMO removes blood from the body, adds oxygen to it, removes carbon dioxide, and then pumps that oxygen-rich blood back in. It allows the lungs to rest and heal while the machine's doing the work.
Wow. So like an external lung support system.
Exactly. It's a last resort for those most severe cases, but it can be a true lifesaver, gives those lungs the chance they need to heal.
It's amazing what modern medicine can do these days.
Yeah.
But even with all these treatment options, I imagine the road to recovery can be, well, pretty long and challenging, right?
Oh, it absolutely can be. And that's actually something we're going to delve into much deeper in the next part of our deep dive.
Okay.
We'll explore the long-term effects of ARDS, those factors that impact recovery, and the support systems that are out there for patients and families.
All right, so stay tuned for that after we hear from our sponsors. Welcome back to the deep dive. Before the break, we were talking about, some pretty intense stuff. ECMO, those really severe ARDS cases. It's pretty amazing what modern medicine can do.
Oh, it is.
But even with those medical advances, it's not like you just bounce back, right? ARDS can have a lasting impact. So let's talk about that recovery process. What does that look like long term?
Right. It's not just about getting through that initial crisis. It's about dealing with those potential long-term effects. And it really varies from person to person.
That makes sense. The ARDS Alliance, their materials really emphasize that.
Yeah.
It's not just about surviving, it's about living with the effects.
Yeah.
What are some of the most common ones that we should be aware of?
Well, I think, as you might expect, reduced lung function is a big one. Even after the initial inflammation goes down, the lungs, sometimes they just don't fully recover.
Right.
And that can leave people feeling short of breath, like they can never quite get enough air.
It's hard to even imagine what that would be like. Something we take for granted, breathing, suddenly becomes this constant struggle.
Exactly. Yeah. Imagine struggling to climb a flight of stairs or walk a short distance without getting winded. Every day, things become, big obstacles. And some people might even need supplemental oxygen, even after they've been discharged.
Wow. That really puts it into perspective.
Mm.
So are there other effects we see besides, the impact on the lungs themselves?
Oh, absolutely. ARDS can affect other organs too, especially if there were complications during treatment. Muscle weakness, fatigue, those are common.
Right. Makes it hard to regain that strength.
Yeah, stamina too.
And I remember the ARDS Alliance mentioned cognitive impacts like brain fog. Is that something that you see often?
Unfortunately, yes. It's not uncommon. Memory problems, trouble concentrating, it's often called brain fog. Imagine trying to, focus on work or have a conversation when your mind feels fuzzy.
It's hard enough as it is sometimes.
Yeah, I know. It can be really frustrating and isolating, honestly.
Yeah, absolutely. It really is clear that ARDS affects the whole person, not just the lungs. And of course, we can't forget the emotional toll it takes.
Yeah, the anxiety, the depression, PTSD, these are real struggles and we need to address them.
Absolutely. Experiencing something like that, respiratory failure, the ICU, it's incredibly traumatic. What kind of support systems are out there to help people deal with these challenges?
Well, thankfully, there are resources. Pulmonary rehabilitation is really helpful for those physical limitations.
Okay.
It helps people improve their lung function, build up their endurance, and they learn how to manage their breathing better.
So it's like physical therapy, but for your lungs.
Yeah, that's a
Yeah.
great way to put it. And along with that, mental health support is crucial.
Right.
Therapy, counseling, support groups. They give people a safe space to process what they've gone through. They can develop coping mechanisms and connect with others who really get it.
It sounds like a combination of professional help and that peer support is really important.
It is. It really is. And, we can't forget about family and friends. Their support and understanding can make all the difference.
It takes a village.
It does, yeah. A whole support system, people who are there to help, to celebrate the little victories.
And that kind of brings us back to something we talked about before, but the different mortality rates with ARDS.
Right.
What are some of the things that affect how those outcomes vary so much?
Well, that's a question that researchers are still working on, and it's really complicated. There's not one easy answer. The severity of the initial lung injury is definitely a major factor. The more damage, the tougher it is for the lungs to bounce back.
That makes sense. The more extensive the damage.
Yeah. And age is a factor, too. Older adults, it's just harder for them to recover. And any pre-existing conditions like heart disease or diabetes, even chronic lung problems can complicate things.
So it's really like everyone comes in with a different health history that affects their experience.
Yeah. Right. And what caused the ARDS in the first place matters, too. Sepsis, for example, tends to have a higher mortality rate than ARDS caused by an injury.
Oh, interesting.
And maybe most importantly, how quickly they get treatment.
So that early detection is really key.
Absolutely. Early diagnosis, aggressive treatment, those are critical for improving survival rates and long-term outcomes. We've come a long way in treating ARDS, but we still have a lot to learn.
Speaking of learning, I remember the ARDS Alliance articles talked about some promising research. What are scientists focusing on now?
Well, one big area is inflammation. Trying to understand that process that really drives ARDS. If we can figure out the exact molecules involved, maybe we can develop therapies that can interrupt that process and prevent the lungs from getting so damaged in the first place.
So instead of just treating the symptoms, we're talking about preventing it altogether.
Exactly. That's the ultimate goal. Another promising area is personalized medicine, tailoring treatments to an individual's genes and their specific ARDS.
That's amazing. So it sounds like the future of ARDS treatment is about personalized and preventative care.
It is. And all of this is thanks to researchers, clinicians, and organizations like the ARDS Alliance. They're doing incredible work.
It really is inspiring to see their dedication. We've covered so much today about ARDS, causes, symptoms, treatments, the long-term effects, even the future of research. It's been a really comprehensive deep dive.
It has. It has. Hopefully our listeners feel a lot more informed now.
I think they do. Before we wrap things up, any final thoughts for our listeners? Anything they should really take away from all of this?
I think the biggest message is this. ARDS is serious, but it doesn't have to be a death sentence. Early detection, treatment, support, and the research that's being done, it gives people a chance to recover. There's hope.
That's a powerful message of hope. And it reminds us that we can all play a role in raising awareness, supporting research, advocating for better outcomes.
Absolutely. Together we can make a difference.
And for our listeners, if you've been touched by ARDS, either yourself or someone you love, know that you're not alone. There are resources out there, people who understand, and a community ready to support you.
And never underestimate the power of knowledge. The more we learn, the better we can fight this condition.
Well said. If you want to learn more, check out the ARDS Alliance website. We'll have a link in the show notes. Stay curious, stay informed, and never stop exploring. Thanks for joining us on The Deep Dive. Welcome back to The Deep Dive. We've really been exploring ARDS from every angle, haven't we? The causes, symptoms, treatments, that long recovery process, it's a lot to take in.
It really is. And it's so important to understand just how deeply this condition can impact people's lives, not just physically, but emotionally, too.
Right, exactly. And I think what really struck me from the ARDS Alliance materials was the resilience. People facing this head on and finding ways to not just survive, but really thrive.
It is truly inspiring, and it's a reminder that even with the challenges, there's always hope. We talked about those physical limitations, the reduced lung function, the fatigue, but we also can't forget about the cognitive impacts, right?
Yeah, absolutely. That brain fog, the memory issues, trouble concentrating, those can make it so tough to get back to, you know, work, school, even just daily life.
It's like trying to function with this cloud over your mind. It can be incredibly frustrating, and for a lot of people, it's really isolating too.
Yeah, I can imagine. And then there's that emotional side of things too, the anxiety, the depression, sometimes even PTSD. Those are serious struggles.
They are. I mean, going through respiratory failure, being in the ICU, potentially facing a life or death situation, that leaves a mark on you. Emotionally, it's incredibly challenging.
It really highlights how ARDS affects the whole person and how we need to approach recovery in a way that addresses every aspect. So what are some of the best ways to support people as they go through all of this?
Well, as we talked about before, pulmonary rehab is really key for those physical limitations.
Okay.
It helps people strengthen their lungs, build that stamina back up, learn how to, manage their breathing better.
It's almost like physical therapy, but for your lungs.
Exactly. And just as important is that mental health support.
Right.
Therapy, counseling, support groups. These can give people a safe place to work through everything they've experienced. Learn coping mechanisms, connect with others who get it.
That combination of professional support and just having those connections, it seems like that can be so powerful.
It is. And we also can't forget about the support from family and friends. That love and understanding, that can make all the difference.
It really does take a village, doesn't it?
It does. It's about building that network, that team of people who are there to help and celebrate all the little victories along the way.
Absolutely. Well, I think we've really done a deep dive into ARDS, explored it from every angle. It's been an incredibly informative conversation. Thank you so much for sharing your expertise with us.
It's been my pleasure. It's so important to shed light on this condition, to empower people with knowledge.
And to our listeners, if you've been touched by ARDS, whether personally or through someone you love, please know that you are not alone. There are resources available, people who understand, a whole community ready to support you.
And never underestimate the power of knowledge. The more we learn, the better we can fight this, prevent it, treat it, and support each other.
Well said. If you want to learn more, the ARDS Alliance website is a fantastic resource. We'll have a link for you in the show notes. Stay curious, stay informed, and never stop exploring. Thanks for joining us on The Deep Dive.